Would you mind to like and subscribe to keep it free for others? You too can send your results.
The question.
Many questions sent to me like, at what size of prostate requires surgery? What is the exact prostate enlarged size that must be treated with removal surgery? When I go for removing surgery, at which big size? What is the serious enlargement of prostate that I must decide to cut it off? When must I take the decision of prostate incision?
Professional explanations. For ordinary people.
Results interpretation.
Normal prostate size is up to 24. While this normal limit is set to young men, medical books define a factor that is causing normal enlargement to prostate, which is the aging. That's mean when an old man got a prostate size measurement above 24 with a little or no symptoms, he should not consider this a bad prostate enlargement. Abnormal enlarged prostate is typically considered when the prostate size exceeds 60 to 80 grams and accompanied with worsening. The commonly occurring symptoms include difficult, frequent, and very little urinating. Consider a prostate removal surgery if you have an enlarged prostate or benign prostatic hyperplasia, BPH, with typically prostate size exceeds 60 to 80 grams. Especially if it leads to severe symptoms, if symptoms significantly impact quality of life such as difficulty urinating, frequent urination, and a weak urine stream. Failure of therapeutic plan and symptoms become worsen. If a big problem accompanies the prostate enlargement such as urinary retention, inability to urinate, recurrent urinary tract infections, bladder stones, or kidney damage can prompt surgical intervention. About 15% of men with normal PSA, less than 4.0, can have prostate cancer. Free PSA percent can only filter some cases to minimize the waiting list for surgical biopsies. And therefore, PSA test is just a tool of many used for judging on the prostate. For very large prostates, a simple prostatectomy may be performed, where part of the prostate is removed through an abdominal incision and called prostatectomy. There are various surgical options available, such as transurethral resection of the prostate, TURP, which involves trimming excess prostate tissue through the urethra using a resectoscope. Also, there are minimally invasive options such as laser therapy, which uses lasers to remove or shrink prostate tissue, and UroLift, which lifts and holds the enlarged prostate tissue out of the way, are less invasive options. Traditionally, suprapubic or retropubic open prostatectomy is practiced on patients with prostate volumes larger than 80 to 100 grams, according to the American Urology Association, AUA, guidelines, although open prostatectomy is more effective than TURP in alleviating symptoms, and particularly in cases of bladder issues. What is the exact prostate size that required to do TURP surgery? Some textbooks outline transurethral resection of the prostate, TURP, is generally considered for men with prostate sizes up to 75 to 120 milliliters. However, their ISN and APOS, TA strict upper limit, and the decision for TURP also depends on the severity of symptoms and how well they respond to other treatments. What is the exact prostate size that required to use laser to remove prostate? Laser surgery for prostate removal, such as holmium laser enucleation of the prostate, HOLEP, is typically considered for men with prostate sizes ranging from 20 to 80 grams. This minimally invasive procedure uses a laser to remove or vaporize excess prostate tissue that is blocking urine flow. The UroLift procedure is a minimally invasive treatment for men with an enlarged prostate due to benign prostatic hyperplasia, BPH. Generally required to being a candidate for UroLift, you should be a 45 years man or older which suffering from frequent urination, a slow urine stream, discomfort or pain in the bladder or penis, and frequent urinary tract infections, UTIs. Also, while there isn't a strict prostate enlargement size requirement, the procedure is typically suitable for men with prostate sizes that cause urinary obstruction. Techniques like transabdominal ultrasound, TAUS, and MRI are commonly used to measure prostate volume accurately before surgery, which is crucial for planning surgery, the prostatectomy, particularly radical prostatectomy. While the size alone is not the only factor considered when deciding on surgery, the cancer and APOS, aggressiveness, patient and APOS, overall health, and other factors also play a role. However, men with small prostate size may experience more unfavorable prostate issues after removal and vice versa.
Bloodtestsresults.com. Happy to help.